Brooklyn Independent Television.
Imagine a world without prescription drugs, one in which the past century of advances in the medicines available to us all had simply not happened. An immeasurable greater amount of pain and suffering, millions more deaths across the globe. It's truly unthinkable. But for too many people, there's a problem lurking amidst all the benefits: the abuse of prescription drugs, and how that can derail someone's health. Here to tell us more is Dr. Andrew Kolodny, chairman of the Department of Psychiatry at Maimonides Medical Center, and an expert in addiction medicine. Thank you for joining us.
Sure.
Just how big is this problem of prescription drug addiction?
It's enormous. This is a problem that's hitting us across the country. It began about 10 years ago.
Why 10 years ago? What happened 10 years ago?
About 10 years ago is when there was a very big push by a few pharmaceutical companies, in particular Purdue, the makers of OxyContin, to market prescription pain pills for folks with chronic pain or pain other than terminal cancer.
Was it direct marketing to people themselves, or marketing to physicians, or both?
A little bit of both, but a lot of it was direct marketing to physicians, inviting physicians to be on their speakers panels. They were actually able to take folks who were leaders in the palliative care movement. These were doctors who had fought a very good fight to see that people with cancer pain would have their pain at the end of life adequately treated. They paid them nice salaries and got them to help market these medicines for more than just people with cancer, but for people with chronic pain or with minor pain.
Well, you know, just to say one thing, not in their defense, but by way of explanation, treating cancer pain is one of the things we had done very badly.
Correct.
Now, is this a huge problem, or is it in the media more because of a couple of deaths that have occurred? Or do deaths occur all the time?
You know, that's a very good question, because sometimes we can assume that there's an epidemic or a drug epidemic because the media will pick up on the story from time to time. And we should really always look at the data and decide on intervention based on data rather than on what the media is telling us. In this particular case, the media is correct. We do very definitely have an epidemic. Just to give you an example of how serious the problem is, every year the federal government does a survey across the nation, 70,000 face-to-face interviews, which is how they get data on drug use trends. And for the past few years, they're finding on this survey that there are more Americans trying painkillers non-medically, painkillers for the purposes of feeling the effect rather than for pain treatment, than actually trying marijuana. So
you mean prescription drugs are being the initiator drug now more than illicit drugs?
Exactly. Marijuana is one of the most widely used drugs, but there are more young people especially experimenting with pain pills than there are even experimenting with marijuana.
Well, how do they get them?
Many of these young folks are getting them from their parents' medicine chest or from the medicine chest of their friends, or they get it from somebody they know.
But in order for them to get it from the medicine chest of their family or their friends' families, somebody has to write the prescription. So are doctors overprescribing, and are people keeping their medications that they don't use? Just how does it go from being a drug that's used to help you to one that is being used illicitly?
There are really two ways in which it happens. One way is that a doctor, and to answer your first question, yes, doctors are overprescribing. Many are. But a patient comes to a doctor with chronic pain. The doctor writes a prescription for that patient, may really give that patient more pills than the patient needed, and that patient becomes addicted to the prescription. We call that iatrogenic addiction. We're not sure how common that is, but for many years we were told by the pharmaceutical companies that it's very rare and almost never happens if the patient has legitimate pain. We now know that's not true. Many patients do get addicted to these prescriptions. So one route is direct iatrogenic addiction. But what's really happened and what's causing the massive epidemic is that our environment has become saturated by painkillers because many doctors have a much lower threshold for prescribing pain pills, so that people are given these medications for a minor injury. They take them home, they may take 1 or 2 pills, and then they leave them in their medicine chest. In particular, it's a drug that people don't want to throw away because they took it and they may have liked the side effect. It sort of felt good, so they hold on to it. It worked, it helped with their pain. They don't throw it away, and then their kids get into it. So it's very, very easy to obtain right now.
What class of drugs is it that is being most abused, and what are the names of a couple of the medications?
Okay. These are medications that we would call opioids. And some of the most commonly used, they're prescribed generally for pain. Vicodin, which is hydrocodone mixed with acetaminophen, Tylenol. Percocet, which is oxycodone mixed with Tylenol. OxyContin, which is the same ingredient in Percocet, but in a whopping huge dose, meant to be time release, but most people who abuse it break the time release. And then actually one of the biggest problems we have today is methadone prescribed for pain. Not methadone given to people who need help in special clinics, but doctors who don't know what to do with their patients who have become addicted and then write them a prescription for methadone pills, which is especially dangerous in overdose because it's very long acting and it can build up in somebody's system.
You said overdose. What's the magnitude, if any, of deaths that are related to illicit prescription drug use? Not counting the 2 very famous people, how many people die each year possibly related to this drug, opioids mixed with, say, alcohol or other forms of overdose?
Tens of thousands of people are dying in the country every year from prescription overdose deaths. If you look at the most common causes of death in this country for adults 18 to 65, the most common causes are cancer, heart disease, and accidents. And when you look in the accidental death group, number 1 in that group is obviously motor vehicle accidents. It used to be that in accidental deaths, motor vehicle accidents were about 90% of that category.
Of accidental deaths?
Yes.
Mm-hmm.
But over the past 10 years, since this problem has exploded, when you look at that group of accidental deaths, today it's only about 65% are attributable to motor vehicle accidents. The rest are largely attributable to overdose deaths with painkillers.
I want to know what it is that physicians can do differently to help stem this epidemic.
I think we really do need physicians to behave differently. And I think for that to happen, they need better information about the risks of iatrogenic addiction. The pharmaceutical companies spent tens of millions of dollars in an effort to misinform physicians and the public. Ultimately, some executives were found guilty of criminal charges for that campaign. Purdue Pharmaceuticals had a slight fine and some misdemeanor charges, but they were never told to correct the record. And we have textbooks that have incorrect information on them and a generation of physicians that don't know the true risks of these medications.
Of prescribing these medications.
Correct.
What can individuals and their families and friends do when they suspect a problem?
Yeah. I think that one of the most important things that parents should do is to not keep opiate painkillers in their medicine chest where their teenagers can have access to them. That if it's their prescription that they need to take, they should keep it in a locked space, and if it's leftover medication, they should flush it out. They should not be holding on to the medications. That's one important area. But I think the other thing that needs to happen is that our young people need better information about the risks. Young people will experiment with drugs. It's a normal stage of adolescence. And most young people make fairly reasonable choices when they decide to experiment. So they have an idea of what a hard drug is and what a soft drug is. They'll experiment with marijuana, which they consider a soft drug, but many know not to experiment with heroin, which they consider a hard drug. Unfortunately, the young people who are making these choices see painkillers as being like marijuana, a soft drug that may be safe to experiment with. They know it's not cut with anything. They know it's been prescribed by a physician. What they don't realize is that it's the exact same class of drug as heroin and hits the same receptor in the brain. There's very little difference between OxyContin and heroin.
That's one of the messages that I want everybody to be left with, and that we need to do a better job of having a broad social marketing campaign to inform adolescents.
Absolutely.
Thank you very much for being with us.
My pleasure.
Brooklyn Independent Television on the BCAT TV network.